Welcome to the Something Good podcast, hosted by Renee Mueller, powered by kwELITE. This is where we interview top business professionals, industry insiders, operational managers, and thought leaders from around the nation, diving into hot current topics to help you experience something good.
All right. Today we have Dr. Kurt Kapels with us in the podcast station. And I understand this is your first time, Kurt, right?
This is my first podcast.
That's awesome. Yeah. So I'm glad that we get to make this introduction. So one of the reasons that we have you as a guest is because you're alumni to Columbus. So graduated Lakeview in 2005?
2003.
2003. I was close.
Yeah.
All right. Awesome. So yeah, that was way after me, way after Tyler. So
It's all just numbers.
that's right. And Cora actually texted me during the commencement ceremony. She said, "Oh my gosh, Kurt Kapels is here doing the speech." And I said, "Well, of course. I mean, so was that your first time for something like that as well?"
That was. Yeah, it was fun. It was a big honor that they asked me. I was very humbled that they thought of me to do that. But no, it was fun. I think it went well. Hopefully I didn't bore people too much and maybe they enjoyed it a little bit, but it was fun to be back there, and apparently the first one in the new gym, which was interesting.
Isn't that cool to see everything that's happened out there? So
it just changes so fast. It truly does.
Yeah, talking to the superintendent, he said, we really should have went bigger, which is always the problem, I think it sounds like. So
that's no matter what kind of build or renovation. Or
I mean, CHS is the same way. So everybody's just, sort of blowing out the walls with all the expansion. So
which is a good thing.
It is a good thing. So, and you are a hospitalist with Columbus Community Hospital as well.
I am. So I'm a hospitalist. I'm the clinical director of a private group called Inpatient Physician Associates. And yep, we work at the Columbus Community Hospital, great partners of ours. We've been there since about 2010. Okay. And so it's just been an awesome relationship that has just grown and grown. And I've been there personally since 2014. So.
Well, is that the year that you guys moved back?
That is the year we moved back. Yep.
Okay.
So I graduated medical school in 2011 and finished residency 2014 and came back.
And where was your residency?
I did all that at the Med Center in Omaha, University of Nebraska.
Okay. So
yep. So 7 years there.
Okay. Wonderful. And your wife, Morgan, is from Columbus as well?
She is. Yep. She's a CHS alumni. She was 05.
Oh, same year. You had to think, 05. As long as you know your anniversary.
I was 2003, so she's a couple years behind. So.
Yeah. Wonderful. And you guys have 2 little boys?
2 little boys. Yep.
Okay.
So. They keep us busy. One's a toddler, one's a 6-month-old. So we are busy in a fun way.
Sleep deprived at home and at work?
What's that?
I said sleep deprived at home and at work.
Yeah, it's fun though.
Yeah.
It's fun.
Yeah, awesome. And so both families are here as well?
Yep. Both families are nearby. So we've got grandmas and grandpas for backup and siblings around. It just makes it fun. Cousins around that they can play with each other.
Yeah.
It's just good.
That makes a big difference. Yeah.
Absolutely.
So on that note, is that really the number one reason that you guys decided to move back to Columbus?
Well, it's a nice plus for sure. I wouldn't know if that's the number one reason. I think looking for our careers and where we wanted to start a family and where we could kind of have the whole picture. And Columbus just had everything we were looking for. So we wanted kind of a smaller environment. We were hoping for, jobs that we could be active and involved in and play active roles rather than being part of a huge picture, having more of a hands-on role with what we're doing. Plus, yes, having family, having friends, and being familiar with the territory certainly helped. And for me personally, being part of my group and the organization at Columbus Community Hospital, just something that's so proactive, so forward-thinking, something that's growing was enticing.
Yeah, they really are. I mean, they're a big part of Columbus, obviously, and so they're moving and shaking all the time. They're expanding all over the place, so I enjoy seeing their projects. And obviously, one that's very close by, is the new complex that they're building, which is huge.
Yes, they've got a number of projects ongoing right now. So the field house, obviously, is underway, and that's an exciting thing. I think a great thing for Columbus.
Oh, it'll be a great thing for Columbus. That's something definitely needed. So over the last 5 to 7 years, I would say the landscape really has changed quite a bit. And so for the agents and staff that are here, I usually tell them if you're going to complain, then go volunteer, go be part of something, go try to make it happen. And instead of sitting back and watching it. So it looks like you do the same. I think you're involved with Habitat.
Yes,
right?
So I'm a board member for Habitat for Humanity here in Columbus, something I've done for 5 years, I think now. So it's a wonderful organization that obviously you're involved in the community, you get involved with your house recipients, your board members, your volunteers. You learn so much and you get a hands-on approach as well. That's one of the benefits to being in somewhat of a smaller community is there's plenty of opportunities for community involvement.
Yeah, no doubt about it. So And so your wife, Morgan, is she part of some of that as well? Does she get involved?
She works like through the Columbus Public Schools Foundation and does a few other things here locally. Right now, she's pretty busy, especially with us being pretty busy.
Yes.
She's kind of had to take a lot of the things at home under primary control, so which is probably better for everybody.
Oh,
so.
for sure. Two little ones will definitely keep you busy. So, and I'm sure they'll be the same. They'll be all over the place with sports before you know it.
She's amazing. She does all kinds of things.
Yeah. Awesome. So with you moving back here then and being part of Columbus Community Hospital, was it something that you sought after that position, or did they really recruit you? I'm just curious because
it's funny. Yeah. So our hospital's program was up and going for about 4 years, I think, when I came back here and started. But when they started recruiting me, it was a pretty fresh program. And I think they actually saw my wedding announcement in the newspaper, like some of my partners did, and knew that I was from here. I was a hospitalist. And that's what kind of sparked things for the conversation to kind of start.
You just said newspaper again.
Yeah.
I'm sorry, that's so funny.
Yeah.
I got to tell you, when I was first in the business, which was in 2000, I don't know if you know Rhonda Furneaux or knew the name at all, because Furneaux's were at Lakeview as well. But anyway, I remember when I started, she said, Renee, in order to get yourself out there, get into some of these sales, she said, you got to watch the newspaper for wedding announcements, things like that. Send something to those people. And I'm thinking,
right,
well, you're corny. I mean, but obviously it works.
There's a place for everything. Absolutely.
All right, marketing person Matt, can you keep that? That's funny. So they sent you something. Exactly. They sent you something and started recruiting just from.
Yeah. So they made contact with me first. I always had interest in potentially coming back home if the situation was right, but didn't know much about the situation with hospitalist medicine, where things were at with the hospital here. When you're in med school, you're kind of just lost to the world for a while.
Right.
You get your head down in a lot of ways and just doing what you need to do to get through and to learn and sharpen your skills. And so, so that's kind of how things started, and started kind of doing visits at sites and comparing things. And like any other career, you're just looking for what fits you best and making your comparisons between, your finalists, and it couldn't be beat.
So what were the top three?
Top three? Well, I'm not going to mention specific places, but we had a top three, and they all had a lot of similar traits, but Columbus definitely stood out for a lot of reasons.
Good. And this was, you said, 2010, correct?
That's when our program started. Okay. They probably started recruiting me maybe 2011, somewhere in that ballpark.
So how much has changed? What have you seen change since that
Oh,
point in
boy.
time?
Well, if you go back, I think when I was in high school is when they built the new hospital. So I even remember when that change happened, which was a big step. But since then, we've undergone hospital expansion, ER expansions. The field house obviously is ongoing, adding tons and tons and tons of subspecialties. Our hospitalist group is growing. We actually hired a new partner as well, who's going to start this fall, Dr. Buckley. So we've grown, the hospital's grown, the service lines have grown. The more things that can be offered to our patients in the local area here has grown tremendously, which is good for everybody.
Right.
If we can keep patients here, and if they can get high quality, effective care here.
Right. And so obviously the demand is there with a community this size.
Absolutely.
There's a ton of services that the hospital has that probably, I'm sure people don't even know about. But
it's just growing every year. And so, I like to think we as a hospitalist group have a lot to do with that. So as a hospitalist, what I do is we're internal medicine doctors, board certified internal medicine doctors who care for patients only in the hospital. So that means we don't do any clinic. We don't take care of folks once they're outside the hospital. But when they're in the hospital, we manage their acute care. We are adult hospitalists, so we don't take care of pediatric patients. We do have pediatric hospitalists who are pediatric trained. So
you do have those.
Yep. So our pediatricians run a pediatric hospitalist service, so they can care for patients in the hospital in Columbus as well, which is growing as well. So, but we have kind of a broad education base, kind of a broad experience base. We practice internal medicine, so we see a wide spectrum of medical issues and are trained to help care for those medical issues.
So is it more in comparison with a general practitioner?
Kind of. In a lot of ways, it's kind of like being a primary care doctor in a hospital setting. So you're focused on both the general care and the overall management of your patient. So coordinating subspecialties and services, the plans of care for transitioning of care and discharging, those kinds of things, follow-up appointments, um, putting together what the next steps are in the care of your patient. And obviously that becomes important with our primary care doctors, who are fantastic here in the area. So we do a lot of coordination with them, kind of like running a relay. You hand off the baton and they take it from there. So it's a very collaborative way to practice medicine.
Yeah, no doubt. So is there a patient-doctor ratio that you have to meet, or?
Oh, no, not necessarily. So ours it's different from outpatient medicine where you schedule appointments.
Sure.
Ours is usually the unscheduled stuff. Now, certainly there's outpatient procedures that end up staying in the hospital, and we help to care for some of those patients as well. But most of the time when you're going to the hospital, it's for an unexpected issue. And so you can have your busy days, you can have your slow days.
Yep,
but as things grow, certainly busier and busier is kind of the general trend. And certainly the last 2 years have only amplified that.
Yep,
so.
that was on the topic. So speaking of the last 2 years, so through COVID, I'm sure you were just living at the hospital pretty much.
Very busy.
Yeah.
Very busy.
Has that changed or improved? No?
Things have definitely improved. We have a lot more in our repertoire to help people. So there's a lot more treatment options, a lot more knowledge base when it comes to how to evaluate patients, what to expect as far as disease progression, what you can do to try to stop that earlier. Other things like vaccines to try to prevent significant illness from developing in the first place. So there's a lot more that we have, in our arsenal to try to help us take care of those patients. It's just
through
ongoing
comes
and
the
evolving.
Education and
and the illness itself evolves. And so it's looked different as we go.
Yeah, it's so interesting, isn't it? So this physician that you hired, is this number 4 or 5?
So we have Dr. Bossard, who's our medical director. He started our program here in Columbus. And then myself, the clinical director, Dr. Alicia Meisner, Dr. Scott Cameron, and then Dr. Chris Buckley will be starting. So there's 5 of us.
Wow, good deal. And so where is Dr. Buckley coming from?
He's finishing training at the University of Nebraska as well in Omaha.
So then with the title of hospitalist, is that, I already asked if that was really in comparison with being a GP, but was this something that you sought after when you were in med school? Was there a certain area that you wanted to go, Dr. Kapels?
When I started medical school, like a lot of students, you have a general idea of what you think you want to do. I was thinking probably family practice, but part of medical school is you see everything. You experience a lot of things, and you kind of find out pretty early what you want to do, what you don't want to do. And so there's a lot of points where you decide, do I want to do inpatient primarily focused? Do I want to do outpatient primarily focused? Do I want to try to do both, which is still possible to do? Do I want to do general care? Do I want to do something surgical? Do I want to subspecialize to a certain organ system or physiology? And you kind of find what you like and what you don't, and where your skills are. And so as I spent more time in a hospital setting, doing rotations, seeing patients, learning from doctors, just kind of fell more in love with the inpatient side of things. Just felt more like me.
Yeah, good deal. That's always interesting just to see how that's decided, or if it's sort of decided for you, with what comes open. So
yeah, it's kind of, there's a limited amount of residency openings, and so depending on what type of doctor you want to be, some are more competitive than others to get into as far as residency spots. So after medical school, you go on to residency, which is kind of an apprenticeship. After that, you can go on to fellowships and other more and more subspecialized training. And so depending on what you're looking at going to, it's all competitive. But
so the fellowship isn't something that's required?
It is not.
Oh, nope. I always thought it was after your residency. So
a residency is. So I did a residency in internal medicine, me and my partners. If you want to go on to subspecialize further, like cardiology or something else, then you can go on to a fellowship. Okay. And so those become more and more narrow, the more and more narrow your focus becomes.
Yeah, interesting. So then you need to live within city limits, I'm sure, working at the hospital, correct?
Yeah, more of a time, you have to be a certain amount of time away. You have to be available within a certain period of time to manage emergencies.
Okay, so 15 minutes-ish somewhere in there?
Usually 15 to 30 minutes, yeah.
Okay, good deal. One other question I have, I guess, is I wonder how much technology has changed things for you, especially over the last 2 or 3 years, because it seems like it's really sped up as far as how those changes take place. So
tremendously. So, for instance, this might not mean much to you, but when I was in residency, we still did a lot of paper charting, orders were written on paper.
It does mean a lot to me.
Yep.
We're
So
paperless.
notes, those kinds of things. That was all done on paper, and then transcriptions where you'd use a tape recorder to make notes and you'd send it off, and somebody type it up for you.
Right.
During residency, a lot of that shifted to electronic medical records, and so bringing in computer systems and software to manage to organize the care of the patient was a big hurdle for everywhere, and a lot of places are undergoing that transformation or have undergone. Pretty much everywhere has gone that. That's essentially a requirement. So that was one of the first big changes that really kind of shook things up. And obviously, during a pandemic, especially a highly contagious pandemic, you try to use technology as much as you can to assist in the care of your patients, and that's no exception here. And we've really utilized a lot of telehealth resources, and that area of medicine worldwide has grown tremendously, especially through this pandemic.
I think that's so interesting. I hear a lot more people saying, I'm not going to say Omaha or wherever for a specialist appointment. We're doing a telehealth.
Correct.
Which, super interesting, because who would have thought, you know?
And that was coming down the line, but COVID definitely sped that. That was the way medicine was going to go, because that's a good way to get resources out to smaller communities, especially in a state like Nebraska, where you don't have the subspecialist nearby. So you're right. A lot of it was send the folks to the bigger cities. Now we can keep more and more of those patients locally, and it's more enticing for people to want to practice in smaller and medium-sized towns because they also have access to more and more subspecialties to help.
Yeah, it makes sense. Technology really has, it's sped up and it's helped with that, because we find the same. We can serve clients that are in smaller areas that maybe, or agents even, or would-be agents, in markets that are 45 minutes, an hour away, where they don't have access to, maybe a big office. So
and you can show people a lot of things as providers. You can actually assess people using an interactive cart. So stethoscopes and other things, you can actually auscultate and evaluate
so
people.
Amazing.
It's pretty incredible, and it works pretty slick. You can access electronic medical records. So electronic health records are not all the same system. There's lots of different software companies and providers out there. And so interconnecting those things and being able to access those is another thing that you really have. That's really evolved over the last couple of years through COVID.
You thought you were going into medicine. Now it's really technology.
I joke about that a lot. Yeah, you really kind of need
funny.
A computer degree.
Exactly. You do. I mean, something.
It would certainly be helpful in a lot of ways. But technology is a big part of it.
Yeah.
Big part of it.
Well, that's amazing. So the last question I have for you, Dr. Kapels, is, I assume you're probably part of the hiring and decision-making with regard to these employees or the recruits. So what are the biggest challenges with that when you're trying to recruit them to Columbus? And I'm speaking on this topic because you're an alumni, and just we recruit on a regular basis. So
so there's challenges, obviously, to being in a smaller town, and we're involved with helping because we're a big partner with the hospital, a big part of what we do here, and so that benefits all of us. So it's challenging because there's no medical schools really in smaller towns. And so people get used to, even if you're from a smaller town, you get to a bigger city to go through medical school. And a lot of times the residencies are largely in larger cities. And so you don't have a lot of experience with smaller towns, or you've gotten away from that. So showing people the benefits of how it is to practice in a smaller town from both a professional standpoint and a personal standpoint is important. And hearing it firsthand from people who actually live in the town and practice in the town, which I and all of our partners do, we can give people firsthand knowledge of what it's like. And not everybody is from a small town that eventually comes back to practice in a small town. So if you can show them, the education benefits for their family, the life outside of the hospital work and what that's like, the things that there are to do in your free time, the advantages of practicing in a smaller community and what we've brought in and what we have planned, and being involved with that is honestly one of the enticing things for folks. Is you're hands-on in a smaller facility more so than you would be in a larger facility.
And I think as involved as you are, and probably the others are, it does make a difference when you can tell them this is what's going on now, this is what's coming. There really are a lot more options than maybe people would think if they're looking on, say, one of the websites that showcased Columbus 15 years ago. It's really changed a lot. So
it's pretty easy to show people what it was and where we're going.
Right, exactly. There's a tremendous amount of growth right now. It's just incredible. So anything else you want to add at all, Kurt?
I don't think so. I've enjoyed being here. I hope people enjoy the services that we try to provide here in Columbus, and can appreciate the growth that we're trying to bring. I always tell people doctors aren't perfect, but we don't have all the answers, but we'll work hard to try to get people answers, and we work hard to try to bring the answers to them. So
yeah, most definitely. Like I said, I think Columbus Community Hospital is a huge part of the community, and I appreciate it. I'll just speak on behalf of all of us here, and those that we recruit to Columbus will say the same thing. So I think everything that is happening now, with regard to what the hospital does is pretty amazing, and so we should all be thankful for that.
Yep,
So
it's a fantastic thing.
Yeah.